Dr. Christian Augustin with Bayside Chiropractic and Rehab. And over the course of the last few weeks, we've been talking about different types of treatments and different types of services we provide in the office. So what I thought I'd do today is I'd give you an example case and kind of walk you through how we could treat somebody like this. Now, anybody that suffered from low back pain or been given a diagnosis of a slipped disc or herniated disc, bulging disc, sciatica, should pay really close attention to this, because I'm going to use that as an example. So we're going to call this patient X. And we're going to say patient X is 35 years old. Patient X comes in with severe low back pain that goes down one leg. He can hardly put weight on his leg, and he's seen a doctor and he's got a slipped disc, or he's told he's got a disc injury. A very common thing to happen. So the patient walks in, and the first thing we do after we sign him in and all the paperwork's filled out is we bring him back and we would do vitals on the patient just to make sure. We take temperature, blood pressure, weight, find your height, make sure there's nothing like an infection or something else going on that's more serious where you need immediate medical attention. Then what I do is I do an exam on you. At the point of the exam, after we take a history, so we go through everything that happened and we do the exam, and I see that you're in severe pain. Now I have to decide how we're going to treat you. At this point, you're having problems lying down, sitting, standing. You can hardly function. So I'm the type of person that thinks that we need to get a little bit of immediate pain relief so I can actually deal with you and treat you. So most likely what I would do with this low back case is I'd send them maybe to their local doctor in urgent care, and I would get some pain relief using medication. I'm not a proponent of medications for the most part, but when a patient is this severe, that's what you need to do, because they can't function, so they can't even lie down to have the treatment. And there's a lot of different types of medications, and medical doctors are really good if you don't want narcotics. I'm very against narcotics because the risk of being addicted to narcotics is high, and they really don't do a whole lot for the pain. So there's other options that can give you some immediate pain relief, and within a few hours, maybe 24 hours, you would come back to the office. Now you're still in a lot of pain, but now at least maybe you're able to walk, you're able to stand, you can sit. Now I can treat you. Now you have a disc injury. So the first thing I want to treat is do something. If you have a muscle spasm that caused it, I might use electromyostimulation to try to reduce the muscle spasm. If there's some edema that I see in the muscles or swelling, I might use ultrasound or again electromyostimulation to give you some release or some decrease in that pain. Then the next thing I would do is probably do decompression, which we discussed, which is a form of traction. And what I'm trying to do there is actually help get that disc hydrated again, because usually when you have disc injuries, it's because the disc is dehydrated, it's become weak, almost like a tire that has dry rot and it pops on you. So what you want to do is get fluid back into that, and traction's a good form, and we use intermittent traction, and we call it decompression. So we start doing that to try to heal the disc. Then we go to the laser room, which helps speed up the process of healing. So laser is used to actually get the cells dividing quicker so you can regenerate or heal or scar, reduce the amount of scar, and actually try to get the disc healed. Then I would take you into my room and I would give you an adjustment. In most cases, when it's this severe, it would be very, very light. For the people that have been to chiropractors, the initial adjustment would probably not be something where I would roll you on your side and do anything high force. I would use a table, and it's known as drop technique, just to keep the pelvis in line and not to at all try to inflame the area anymore. So we'd be really gentle with the adjustment. But the adjustment is important because we want to always maintain as much motion in the spine, because motion will eventually help you recover quicker. And no motion, in other words, being in spasm or unable to move, will usually lead down the road of more osteoarthritis, more problems in the future, and a slowed response to healing. And in other words, it'll take longer. And our big objective is the last place you want to end up is in a surgeon's office. And for the most part, you do not need to end up there. Most of the disc herniations and the disc injuries recover. Now, time frame, if you're expecting things to recover in a day, that's not realistic. But I usually set a pretty realistic goal that I should see some significant recovery and reduction of symptoms within 2 full weeks, maybe 3 full weeks. Then after we've done that, so we've done the treatments, and this becomes on a consistent basis. Much like physical therapy, you can't come in once a month and think this is going to get better. It might be 2 times a week. Depending how severe it is, it might go up to 3 times a week. If you're so severe, I might see you a few days in a row to really try to reduce pain and discomfort and get you moving better. Then what we do is we discuss. So let's give you a few more examples. You're 20 pounds overweight, which has caused some, say, early signs of diabetes. You don't eat real well, your diet's bad. So now we've got you through the 3 weeks, you're doing a lot better. Now, how do you stop this from happening again? Well, one thing we do is the nutritional counseling. So we talk about your diet, because there are foods that you can eat that are anti-inflammatory. And when we do that, if you are overweight, we talk about weight loss and how we can help you lose weight, because obviously the less stress you have on the low back, the less likely this injury is to reoccur. So that's one of the big objectives. Also, if you're on medications, if you're losing weight, most of the time and your diet improves, guess what? Diabetes, type 2 diabetes or adult onset, there's a few different words for it, is usually completely curable with diet and proper eating. There's no need for medications. Most medical doctors will tell you that. The problem is you have to lose the weight and you have to eat right. So if it's early signs, when you go through that process and you start becoming healthier, then we can go to another step where we go on a maintenance type schedule to prevent these further type of inflammatory or flare-ups of this type of disc problem. Again, most people do resolve from these. And the people that have been through them or know somebody that's been through them need to get in touch with them, maybe have them watch the video, because it's really hard when somebody's in a lot of pain, and a week feels like a year, but you can get through these things without going to surgery. And actually, if you ever did and you did these things before surgery and it really didn't resolve, which is only 30% of the time at most, you would have a better chance in the surgery. So if you have any questions, don't hesitate to call the office. I'd be more than happy to talk to you. My number is 251-990-8388. And again, it's Bayside Chiropractic and Rehab. Be healthy, be happy. Thank you.